afternoon, and thank you for joining us for the week's first virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined today by our more full Monday afternoon panel. Mayor Ed Holder is here, as well as Warden Cathy Burghardt-Jesson from Middlesex County, Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie, and Carol Young-Ritchie, Executive Vice President, Interim Chief Clinical Officer and Chief Nursing Officer at London Health Sciences Centre. Glad to have you along as well, members of the media, and we remind you that to submit your questions, just click on the text bubble with the question mark here on Microsoft Teams, indicating your name as well as your media outlet and who your question is for. And finally, to the listeners and viewers tuning in this afternoon on Rogers Television, as well as the Rogers Facebook page and YouTube channel, listeners on Global News Radio, 980 CFPL, and those who are joining us on the CTV London website, a welcome to you this Monday afternoon. Let's begin with our opening remarks, and we'll start with London Mayor Ed Holder. Mayor Holder.
Well, thank you, Dan, and good afternoon, everyone. I'd like to acknowledge National Indigenous Peoples Day, which for the last 25 years on this day allows us the opportunity to recognize and celebrate the unique heritage, diverse cultures, achievements and contributions of First Nations, Inuit, and Métis peoples. There are a number of events being hosted by Indigenous communities groups nationwide, and several right here in London, including Atloza Family Health Services, which is hosting a virtual honoring of Solidarity Day from their YouTube channel. We encourage you to check that out. Where COVID is concerned, and one of many positive developments, we're starting to see a reduction in COVID-related complaints to our bylaw enforcement. But not only that, all weekend site inspections were in full compliance with provincial regulations, and no charges were required. To me, that's another encouraging sign and further proof that our vaccination strategy and the provincial reopening strategy is working. An interesting fact I noticed today when scanning the numbers, did you know that our active case count now stands at 70? That's the lowest active case count we've had in London Middlesex since early November. Not only that, but an active case count of 70 is less than the daily number of cases we were averaging in London just over 1 month ago. That's incredible. It's just further proof that what we're doing is working. It's undeniable. And it's why it's so important as increasing numbers of our people in our region go for second shots to trust the science and trust the advice of our public health professionals. Mixing and matching vaccines is not only safe, it's highly effective. I see this so-called debate as not so dissimilar as to that which occurred many months ago when the decision was made to vaccinate as many people as possible with first doses at the expense of immediate second doses. It's fair to say that several months later, that decision was absolutely the right one. It saved lives. It kept thousands from getting sick. The same is true, if not more so today, when it comes to mixing and matching vaccines. Get the first shot you've been offered. Today, when it comes to mixing and matching vaccines, that's critical. So regardless of the brand, you get that first shot and continue driving those vaccination rates higher by the day so that we can all enjoy the summer we want and that we all deserve. Over to you, Warden Cathy.
Great. Well, thanks so much, Mayor Holder. And as always, it's great to be with this gang on a muggy Monday afternoon. I trust that everyone had a good weekend celebrating all those that father in a special and meaningful way. With the numbers in our region as they have been, let's hope that yesterday was one of the last family-centered celebrations that we are asked to celebrate with restrictions. As we begin to prepare for the next stage of reopening, I would ask that you continue to support local eateries and retailers. It cannot be lost on any of us the sacrifices our small businesses have had to make, and they will continue to need our support in the days and months to come. As school winds down and you consider vacation, as was the case last year, do not be afraid to explore your own backyard. The Middlesex-London region has so many hidden gems that I encourage you to plan your visits to them. And with regards to vaccine, if you can bump up your second shot for your vaccine, please do so. And if you haven't yet gotten your first vaccine, I really ask you to reconsider and book an appointment to get that first shot. There are so many more options available out there. As the Mayor mentioned, today marks the 25th anniversary of National Indigenous Peoples Day, and it's a day to celebrate and recognize the heritage, cultures, and contributions of Indigenous people across the country. How can you do that? When traveling in Southwestern Ontario, the province, or the country as a whole, acknowledge and learn about the territories that you pass through. Educate yourself on what reconciliation really means. Try Indigenous food. And when you are shopping online, consider buying a special Indigenous piece of artwork or jewelry, or supporting an Indigenous company. It's really not that hard. Over to you, Dr. Mackie.
Thank you very much, Madam Warden and Mr. Mayor. I also really appreciate the acknowledgements of National Indigenous Peoples Day, obviously an important day for this nation, and one of those things that we all should be observing as part of our commitment to reconciliation. On the COVID front, tremendous weekend, single digits all weekend, no deaths. This is great news, and big credit to everybody who has been part of the vaccine campaign, from the vaccinators to the people that came down to get the shots. Also, I agree with the Mayor's comments that the reopening plan is right on track, and people seem to be still doing their best to respect the guidelines, avoiding indoor gatherings as much as possible. Credit also, of course, to Mother Nature for making it easier for us to keep it outside, keep it safe. I do want to flag one thing on the vaccine front. Today is the beginning of our vaccine Olympics, so moving almost 6,000 doses through our combined mobile and fixed clinics today. And one of the mobile clinics that we have today is at the school, within one of the local schools. We have 9 clinics over the next 2 weeks.
Dr. Mackie, your microphone just muted.
I'm charming. Okay, is that better, Dan?
It is, thank you.
Great. Just highlighting the school clinics that are kicking off today. These are pop-up walk-in style clinics. You can book in advance, but you can also walk in. We actually still have appointments available today at the pop-up clinic. The location today is the Sir Arthur Carty Catholic Elementary School. That's at 1655 Ernest Ave, and we have some appointments between about 3 o'clock and 5 o'clock today at Sir Arthur Carty. We will be in a different school each day this week, and then for 4 days next week as well. And thanks to everyone who has helped set those clinics up and already booked themselves and their youth into those clinics. Dan, I'll pause there and I'll pass to Carol Young-Ritchie. Thank you for joining us, Carol.
Hi, everyone. Good afternoon, and thank you again for this opportunity to join today's briefing to provide an update on the COVID situation at London Health Sciences Centre. As of this morning, we are caring for 15 COVID-19 positive patients, 9 of which are in critical care. Of the 15 COVID-19 patients, we are caring for fewer than 5 from outside our region and within critical care. We're also working to continue to contain our outbreak on the 8th floor transplant unit at University Hospital. Fewer than 5 patient cases and fewer than 5 staff cases are associated with this outbreak. While there is always uncertainty as to the source of the outbreak, our approach at LHSC has been to take immediate action as though the source was within the hospital. This is prudent and puts our patients first. With that in mind, we've implemented extensive infection control procedures, including enhanced cleaning, testing of our patients, staff, and physicians in the unit, and closure of transplant unit space to new admissions. We are also taking a whole system approach with this outbreak, similar to the way as we continue to evolve the pandemic itself. This involves working with St. Joe's Hospital to transfer patients that are more appropriately cared for in their facility, discussing potential transfers with LHSA patients with our partner hospitals in the region in order to free up space and capacity, and transferring patients from University Hospital to Victoria Hospital. This includes opening up a 12-bed unit at Victoria Hospital to care for patients who would have normally been treated at University Hospital. In order to effectively contain and end the outbreak, we continue to reduce patient admissions on the floor. This involves closing some of our inpatient beds at University Hospital. I want to be clear that because of our need to maintain safety of our hospital overall and the patients and staff, we've temporarily postponed some scheduled procedures. I want to reassure everyone that we are working closely with the health unit to respond to this outbreak and hope to return to normal services as soon as we can. Finally, again, I want to remind everyone that our hospital remains a safe place to seek care. Please do not delay seeking care if you or a loved one needs urgent or emergency care. Thank you.
Thank you very much, Carol. Thank you, Dr. Mackie. Thank you, Madam Warden and Mr. Mayor. All right, we do have a lot of questions already in the queue, so let's get to those right away. Jennifer Beeman from the London Free Press has a few off the top today. Dr. Mackie, the first one is for you. Some people are going to be skeptical of mixed schedule Pfizer and Moderna doses. Have there been any appointment cancellations for this week? Is the health unit concerned about no-shows of people refusing doses when they go to mass vaccination appointments?
Yeah, we're seeing a bit of that, Jennifer. We're really not seeing a lot of people who are upset or declining Moderna in the place of Pfizer or vice versa. We've had a few examples, and of course, I completely understand how people would be upset. This is a brand new thing we've been saying all along until now, that people shouldn't be mixing and matching from different doses of different vaccines, but we now know that that's safe and effective. Pfizer and Moderna in particular are very easily interchanged. They're essentially the same product with different brand. So we really encourage people to seek the first mRNA vaccine that they can in order to get their second dose.
Thank you very much. And a follow-up for you, Dr. Mackie, from Jen Beeman. Are you concerned first dose Pfizer folks looking to fast track their second shot will hold out for another Pfizer instead of taking advantage of the Moderna boom? Could vaccine shoppers have an impact on the local rollout later this summer?
Well, I mean, if we started to see this in any significant scale, it would impact the vaccine rollout and it would impact the duration of the pandemic. But so far that, people declining one mRNA vaccine, wanting to wait for another, hasn't been a major factor. Really, we're talking about a handful of folks. So, I'm hoping that we don't see more of that. It certainly would impact the campaign if we saw a lot of that.
Thank you, Dr. Mackie. The next couple of questions are for Carol Young-Ritchie, and they also come from Jennifer Beeman at the Free Press. And these go into a little bit more detail, I think, on the update you gave, that Jen's looking for some more numbers, I think, and some more detail. So the first question is this. What does LHSC estimate its surgical backlog now sits at from the first to third waves? At the current volume, how long will it take to catch up?
Yeah, that's a tough question, Jen, how much our backlog is, because we have had well over a year of reduced surgeries. So what we are doing right now is working with our system partners and with government, looking at how could we start to catch up on these surgeries. And again, matching that with our staff and the staff we have available to do that surgical work. I will say that we monitor this quite carefully. And this week we have amped up some of our operating rooms. So for example, 14 of our 17 operating rooms at Victoria Hospital are opening, 2 operating rooms at our surgery center, and 11 out of the 15 at University Hospital are running right now. And certainly we do prioritize the cases that we do, emergent and urgent certainly taking priority, and then looking at what other cases we can put through, again, given some of our constraints with the outbreak. So we monitor this very carefully and are working with government partners to how we can mount more cases, and again, redeploying our staff back from critical care, who we did redeploy from the surgical services. So again, very cognizant of the backlog that we have and trying to catch that up.
Thank you. And the next question, I think, picks up on that, talking about volume and capacity. So Jen is asking, Carol Young-Ritchie, what is LHSC's surgical volume at now? What is LHSC's overall patient capacity? And how much space is it reserving for the COVID-19 response?
Yeah, our occupancy today, again, we watch this very closely. Our occupancy today, we'd like it to be around 90%. It's at 95%. And appreciating that we are trying to do as much of our backlog volume as we can. So we continue to watch that really carefully and try to mount more cases as we can. Again, outbreak we have closed some beds because of that. So trying to shift that work. And again, working with our health unit partners to be able to free up those beds and provide more care.
And I think this is the last of the three that's just for you. So this one has to do with visitor restrictions. Jen asks, do you anticipate further reductions to visitor restrictions, including for fully vaccinated visitors, in the coming weeks? Is LHSC awaiting provincial guidance on visitor rules?
Actually, visitors are really important to our patients in hospitals, so we watch this very carefully too. So I don't foresee any more restrictions in visitors coming. Certainly to the units that we have on outbreak, we have restricted visitors, but we are trying to have that balance of bringing visitors into our hospitals safely. So I don't see any further changes coming to restrict that. I don't see if there was new provincial guidelines on that, certainly we would abide by those, but as things start to open up, we'll be looking at our visitor policies and making sure that we have that balance of patient safety with our visiting policies.
Thank you very much. And let's go to one more from Jennifer Beeman, and this is for Dr. Mackie and Carol, for you as well. Does the outbreak at University Hospital involve unvaccinated, partially vaccinated, or fully vaccinated people? And what variant strain is behind the outbreak? Dr. Mackie, do you want to take that first?
Sure, but I don't have the information, Dan, so I wonder if Carol does, but
Sure.
We have to dig for that.
Yeah, I'll start off by saying that because of our numbers are low at the outbreak, less than 5 patients and less than 5 staff, that we don't give out that information because of patient privacy. So I can't really comment on that.
Thank you very much. All right, let's go to our next question. This one is from Andrew Graham at Global News Radio 980 CFPL. And I'm just going to go back to it. Here we go. Dr. Mackie, while declining case counts and rising vaccination rates are likely beacons of hope for the public, is there any piece of data that you feel is being left out of the conversation, whether that is something hopeful or something more concerning?
Okay, so pretty open-ended question. Well, let me start by saying that I think that we have a lot of uncertainty around the seasonality of the virus. You are seeing a 4th wave in UK right now, and that's a country that has pretty high vaccine coverage. So that's something we're watching obviously very closely. Delta variant is a factor there, and UK also delayed second doses as Canada did. So that may be playing a role as well. So if that points to anything, it is just that we've got to finish this job. We're not done until we get that second doses in, and we'll have to watch what happens in the fall. We've seen variants emerge very quickly. Hopefully we don't see more of that. If this is a virus that keeps throwing variants at us, then we may be looking at, more waves in the future. I very much hope that's not the case, but the 4th wave in the UK is something that's on the radar for sure, and really pushing us all towards accelerating the 2-dose campaign.
Thank you, Dr. Mackie. And a follow-up question from Andrew Graham at Global News Radio. Dr. Mackie, how has the uptake been now that school-based pop-up clinic appointments are open? Are they drawing a lot of students and families?
Yeah, so the school pop-up clinics aren't the large volume clinics. We're talking about, a couple of hundred, maybe 300 people a day. So they're nothing close to the, 5,500 that are running through the mass clinics, for example. But what they offer is on the ground in the places where uptake has been low. And so for that reason, they're an important part of the puzzle. For those who are sitting on the fence or maybe just haven't been able to organize themselves to get down to one of those mass clinics, the pop-up clinics in those neighborhoods where we know that there have been low rates of vaccine coverage or high rates of COVID, getting the vaccine right into those neighborhoods will help get some of those people who haven't been able to make it to the mass clinic. That's the strategy there. It will make a big difference. It won't be, it won't be a game changer. The mass clinics are still where the vast majority of vaccination is happening.
Thank you very much, Dr. Mackie. And just for the media on the line, we did publish a link in the question form here on Microsoft Teams that points to the website where the full list of the clinics, the pop-up community vaccination clinics are, and as well as the dates that they're being held. So next question, Dr. Mackie, this one is from Jane Sims at the London Free Press. Dr. Mackie, some land and air border restrictions are being lifted as of July 5th, including the required 14-day quarantine for anyone who's coming into Canada. Have we reached the right time to loosen up cross-border restrictions, or are we moving too fast, too soon?
It's encouraging to see what is happening in the U.S. in terms of relatively low rates of COVID across the country. The ongoing concern is that the vaccination rate is low there. And so part of why U.S. is doing better than their vaccination rate would otherwise predict is because there has been so much COVID and people have naturally acquired immunity there. What we don't know about naturally acquired immunity is how long it lasts, and also whether it cross-protects. U.S. has not had a lot of Delta variant, for example. They've had sort of the Alpha variant predominantly. So does that give good protection? Do we start to see outbreaks continuing popping up in the U.S.? Obviously, it's a much bigger question than a public health question. The economy relies on deep connections with the U.S. in many ways. So, that policy decision, fortunately, is left to the elected officials and not to myself. But keeping an eye on things in the U.S. will be an important part of our strategy going forward, and wouldn't be surprised if we see seasonal waves there that might spill over into Canada.
Thank you very much, Dr. Mackie. Let's go to our next question. It is from Sophia Rodriguez at CBC London. Dr. Mackie, are you expecting mixing and matching vaccines to be something that extends beyond this week? Should people who have an appointment in the future start getting comfortable with the possibility of getting a different brand?
Appreciate that question, Sophia. I definitely hope that this is something that people get accustomed to. We will see ebbing and flowing of different vaccine supplies. We're already being told that there may be a reduction in Pfizer availability early in July, but then a big bump of Pfizer availability increasing later in July. So, it will be a bit of back and forth and doing our best to make sure that we don't have to cancel any appointments and that we can get vaccine to people when they need it. But absolutely, we need people to wrap their minds around the concept that Pfizer and Moderna are the same drug with different brands.
Thank you very much. The next question, Carol Young-Ritchie, is coming for you. It's from Jennifer Beeman at the Free Press. Carol Young-Ritchie, what percentage of LHSC staff have received at least one dose of COVID vaccine? And how about those who have received 2 doses of vaccine?
Thanks, Jennifer. We do ask our staff to self-report, so we think our numbers are a bit higher, but what we have on record right now is that 69% of our staff and physicians have had their first dose and 20% have had their second dose, and we still encourage our staff to report those numbers to us.
Thank you very much. All right, and that does bring us to the end of our questions for today, and we do appreciate them all. Got through a lot more than I thought we were going to get through more quickly, so that's a great thing. We will be back with our next virtual media briefing on Thursday afternoon. That will be the 24th of June. Yeah, I had to check there for a second. And a reminder that for next week, we will have virtual media briefings on Monday and Wednesday, as Thursday is Canada Day. So between now and Thursday, thank you very much for joining us. Thank you for your questions. Mayor Holder, Warden Burghardt-Jesson, to Carol Young-Ritchie and Dr. Chris Mackie, thank you so much for your expertise, your insights, and your information this afternoon as well. That'll do it for today. We'll see you on Thursday. So long for now.